I'm very excited to get to talk with these women. This has been an area that's very close to my heart for a while, and the focus of my studies, and also work that I do with a data science and crisis organization part-time. So excited to introduce the first panelist today we have for you is Dr. Erica Nelson. She wears many hats. She's an emergency medical physician at Mass General Brigham. She's also the co-founder and co-director of the Humanitarian Geoanalytics Research and Education Programs at the Harvard Humanitarian Initiative. She's also Harvard Medical School faculty, the deputy medical director at Team Rubicon, and I'm sure a number of other things as well that just did not fit in the bio. So she has a PhD in International Peace Studies and Development from Trinity College Dublin. She did her medical training at the University of Washington, her residency at Harvard in emergency medicine. And she also has an MAS in geospatial analytics for public health from Johns Hopkins. So as you can imagine, with her experience, she has worked in a wide range of areas, which I will let her tell you more about. But these include kind of medicine for conflict-afflicted populations, so researching and advising on that, developing spatial methods for atrocity prevention, and working at the intersection of climate, conflict, and migration, just to name a few. We also have joining us Rana Hussain, who graduated from Boston University with her degree in mathematics and computer science, and is now working as a research associate at the Center on Forced Displacement at Boston University. So Rana works on projects to assess the health of vulnerable and displaced communities, which has included working with UNICEF on computational modeling to assess and predict child malnutrition in Yemen, working with the Pakistani NGO to look at the health risks for stateless communities in Karachi, and also has been involved leading a workshop that is very interesting and kind of helping the next generation do this kind of work even better than we are, on incorporating kind of forced displacement into STEM education programs at the undergraduate level, which has been implemented in a number of universities. And then finally, we are very grateful to have Daphne Joseph, who was the last minute change to the program after COVID stepped in and once again, reminded us it's still here. But we are very, very grateful to have Daphne, who is a research fellow at McKinsey & Company. So she is providing a little bit of a different perspective. She works in both quantitative and qualitative work. So she has her degree in sociology from Spelman College and her master's in human rights studies from Columbia. And at McKinsey, she focuses on human rights and humanitarian issues. And so in her work, she collaborates with global foundations, NGOs, nonprofits, governments, and this includes kind of work with philanthropic data, development data, but also kind of focusing from a qualitative perspective on understanding the experiences and the needs of immigrant populations who are displaced by conflict or other political unrest. So she's here to provide kind of a really useful balance, I think, to those of us who might be more with our head stuck in the data and less able to see the broader picture. So I'll pass it off to each of the panelists to introduce themselves further, and then we're planning on just having a discussion amongst ourselves before, at the end of the panel, opening it up to questions from all of you. So Erica, if you would like to take it away.
Thank you for that magnanimous introduction. My name is Erica Nelson. I do, in fact, wear many hats. And as they are pulling up my PowerPoint, I've been in the humanitarian healthcare space for about 20 years. And one of the things that's really come out of that is the recognition that medicine is not a panacea, and nor should it act solipsistically within a conflict-affected or humanitarian crisis space. So that led me on a very interesting journey. But today, I'm going to focus specifically on looking at data science for humanitarian work within the conflict space. Ooh, it works on both sides. Brilliant. So first, we'll talk a little bit about humanitarian geoanalytics. Exactly what is that? What on earth am I talking about? I'll briefly go into our programs at the Hum Geo program. We'll whip through a bunch of examples, and then I'll kind of posit some core challenges and some potential solutions that hopefully will frame some of our conversation. So humanitarian geoanalytics, as everybody here can assume, a humanitarian crisis is a stochastic environment. right? There are so many variables that go into humanitarian crises: demographics, climate change data, socioeconomic, sociopolitical data, movement data. And in so being a stochastic space, we have to start to incorporate multidisciplinary, transdisciplinary, and interdisciplinary methodologies, conceptual models, data sources, and geoanalytics, from my very specific standpoint, is an extraordinarily profound and powerful way to do that, because everything exists in time and space and time can be those things that unite all of this multidisciplinary data. So under the Humanitarian Geoanalytics program, we bring together all of these different interdisciplinary models. We bring together humanitarian studies, medicine, environmental science, behavioral science into our ABM models. We think about how do we include optimization research, predictive analytics, and we use this all towards an eye towards translation. Right? Because my goal is not to publish a paper, my goal is to actually impact the lives of those I hope to serve, right? So we do a lot of research in order to create those standardized methodologies and to create an evidence base, but then we really go to see how do we translate that information into impactful programmatic design, advocacy, education, and policy. So from our standpoint, we believe that spatial methods allow us to make better insights and create better programming. In the public health world, that's actually starting to burgeon significantly more than it is in the humanitarian space. There's a lot of reasons for that. But we can begin to ask questions such as, where are the populations most in need and most at risk? We can say, how are the different variables influence the crisis across time and space? We can use things like network analysis to look at access to healthcare in conflict zones. We can use spatial optimization to utilize historical data to best predict programming and the impact thereof. So our program, we have kind of a couple of nested programs. HumGeo is the bigger one. We hope to transform humanitarian research programming and policy through the practical, effective, and ethical application of spatial methods. And then we also have a sub-program called the Signal Program, which looks explicitly at how do we use spatial methods for atrocity prevention and conflict prevention work. So kind of nested programs. While we are methodologists and really nerdy folks, one of the things that we really want to think about and center our work around and evolve into is these three different principles of decolonization, user-centric design, and critical geography. This is a whole nother conversation, but these are things that we really try to incorporate into all of our work such that we do not create this kind of technocratic, top-down, white person-oriented, privilege-inducing, privilege-reinforcing work. Boop, boop. We work in a lot of places. We have a lot of friends. We're trying to expand them. We do a lot of different types of projects. We are methodologists at heart, right? Nerdy people do lots of different things in lots of different contexts. So I use spatial methods to look at environmental impact of refugee influx using VHR and machine learning algorithms. We look at conflict and health in Palestine, again using VHR, but then also using some cluster analysis and network analysis. We've used agent-based modeling for Ebola response in DRC. We've looked at kind of bigger migration, climate, and conflict in the Eastern Horn of Africa. So as you can see, these things, although humanitarian work has its boundaries, it's very broad, right? It's vast and varied. And so I think this is also a great place for us to start to build out the spatial methods that can be utilized. So again, whipping through really quickly, just a couple of slides to demonstrate some of our work. This is work with a CBO called PIND in the Niger Delta, taking some of their conflict data and parsing it over time, space, and gender in order to start to reveal some of the trends of conflict and violence in a peri-election season over about 10 years. This is one of my nascent projects in which I utilized multiple open source data in order to comment upon gender-based vulnerability in refugee communities in the Rohingya populations in Bangladesh. So this was a combined vulnerability index, Pareto ranking, and subsequent cluster analysis. I see some head bobs, that's a good sign, right? But this really allowed us to start thinking about what influences gender-based vulnerability, where do we start targeting our resources more precisely in order to address some of these things. This, what you're seeing right here, is that VHR analysis and machine learning analysis of the environmental impact of refugee influx in Kutupalong. Again, as I go back and forwards, you can actually see the tents increasing and decreasing over time. And then we incorporated that land use, land cover analysis into a GWR, a geographically weighted regression analysis, looking explicitly at ecological and human-based security parameters. So the impact of this is growing, and it really is starting to influence how policy regarding settlement management, settlement planning is done, and settlement resourcing is done. And then I think this is the last one, and I really hope so because I'm long-winded. But this is utilizing the IOM DTM data, so the International Organization of Migration data, looking at the intersection between climate, conflict, and migration. And we used a spatial temporal analysis to see what are the trends of outmigration over time, but also how do those outmigration trends correlate with climatological variables such as temperature and precipitation. And so, as you can tell, we've seen this. These are some interesting things, right? We've got some interesting outcomes. There are certain communities in which we're seeing inverse relationships between temperature and outmigration, and some communities in which we're seeing positive relationships. And so, in collaboration with our IOM partners, again, this is the user-centric design process in which the communities in which we serve actually are the experts in what the heck this stuff means, came in and said, oh, that's because we had these storms in these periods, and we can start to create explanatory and predictive models for them to be able to better source. So some challenges. Spatial literacy is the thing. I can't tell you, not a lot of people know what spatial analytics are. We're all very familiar with maps. We're inherently spatial creatures, but the analytics thereof elude many of us. There are a lot of ethics when we're talking about data in these contexts, not just around spatial methods. There's a lot of technological and infrastructural things that need to be addressed. Data availability, quality, all of that is really huge, right? Garbage in, garbage out, everybody knows that. But in the humanitarian context, it's even more challenging. And then thinking through different types of data analysis and synthesis. This is yet to be standardized within our fields. How do we disseminate this? How do we break down the silos between communities that are doing this work and actually utilizing this work? And then really addressing the data to impact gap and normative incentivization priorities. What do I mean by that? We can kind of talk about it a little bit during our discussion, but I'm really hoping that maybe we can start to dig in some of these things and think about potential solutions such as building up communities of practice, comme ça, right? Creating continuity of engagement and learning, building spatial literacy, creating technological and resource capacity with our colleagues, and then transforming incentivization processes and funding procedures. So I'm looking forward to this conversation. Muchas gracias.
Hi everyone, so my name is Rana Hussain. I'm a research associate at the Center on Forced Displacement, which is an interdisciplinary research center that deals with issues related to forcibly displaced communities. And I'll be talking very briefly about two main projects I've been working on that Natalie introduced. One about estimating malnutrition in Yemen using different computational tools, and another more education-based, where we're working on developing courses that equip students to grapple with these kinds of questions. Sorry about the slide, but so this project we began a couple years ago, and to provide some background, so in Yemen, as you might know, rates of malnutrition among children are among the highest in the world, and in trying to plan services, humanitarian organizations will use the standard calculation in order to predict the number of cases expected for that year. And that standard calculation, they're trying to find the incidence, the number of new cases developing, because that will let you know how many treatment services you need to provide, how to allocate your resources. So that calculation relies on prevalence and the average duration of an episode of malnutrition. And it's just a standard calculation. You plug in the numbers. The other numbers are constant. And so some of these factors, these variables, are coming from the study that was conducted in the 1980s from 2 countries, and then it was applied across the board to all countries over time in very different contexts. And so there were clear limitations to this, but there was nothing done to replace that number, just because it's very hard to measure the duration of an episode of malnutrition, just because there are ethical constraints related to that. You'd be measuring an untreated episode. If you're aware of an untreated episode, then you'd be providing treatment. So there's just no alternative. We know there are limitations, but there's just nothing to replace it. And so recognizing that this gap existed, this was kind of the motivation for the work that we were doing. We saw work in other contexts very early. Very few projects were starting to explore this, but they did find in some African countries that they did proven that this number was actually very inaccurate. There were actually much more cases than that number was giving them when they plugged it into that equation. And so we wanted to explore this in the context of Yemen, given that it was among one of the most unstable contexts, and we expect it to be much worse than that constant number is giving us. And this was a collaboration with UNICEF, so we met with them very frequently. They gave us a lot of very helpful input. They were able to validate our assumptions, tell us if the conceptual assumptions of the model made sense to them, if the numbers are making sense, and guided us through the entire process. And so to get a more improved estimate of malnutrition incidence among children in Yemen, we developed this computational model called a Markov model. And it was informed by UNICEF program data and a number of values from the literature, which we couldn't find specific to Yemen. And so when we ran this model, we found that the findings were consistent with the other contexts we had learned about, in that the number of cases was actually much higher than initially predicted. We were able to find corrected incidence correction factors for this particular context, which we hope will be used by the UNICEF team in order to provide more accurate estimates and guide their programs accordingly. So we found that for moderate malnutrition, it was 36% higher than those initial values were giving them, and 58% higher for severe malnutrition cases. And we're working on expanding this work to think about the specific drivers of malnutrition in order to make this model more something that they can provide inputs to and then produce outputs based on the changing situations of the country. So the second project I'll talk briefly about is a workshop that we organized. And so this workshop was motivated by the fact that we found that there was not much being done to address the issue of forced displacement, despite it being one of the most pressing global challenges of our time. Nothing was being done in the STEM fields to address it. A lot of the work that was being done was very concentrated in the humanities, and although there are lots of places for STEM to intervene in this issue, given the number of health concerns that displaced communities face, the fact that they live in conditions affected by conflict, informal settlements, poor housing conditions, all of which provide opportunities for STEM to intervene in those issues. There was really not much being done in the STEM fields. And we did see that there are a number of models that exist, for example, in humanitarian engineering that kind of grapple with these issues. But we found that they weren't really allowing students to address these issues holistically. They were relying on very siloed approaches. They would focus on a lot of the same issues, sanitation and hygiene. And they would still kind of, while there was improvement in this, they were still kind of promoting this techno-solutionism. So students would explore the needs of a community and then kind of have the mindset that we need to apply these engineering technical skills that we have, even if maybe a technological solution is not the most appropriate in every situation. And so last spring we put together a workshop that would kind of address these questions. We brought together people in academia, practitioners in human rights, STEM, forced displacement, and pedagogy. And so we kind of discussed what kind of gaps existed in existing curricula, what kind of course we wanted to develop. And so throughout the two-day workshop, we slowly pieced together different components of the course that we were trying to develop, which we hoped would be a general model that could be applied across different disciplines within STEM. And so by the end, we ended up with a very detailed course sketch that kind of outlined the curriculum, the assignments, the kind of content it will cover. And this course ended up, after developing it for a bit with the people who plan to pilot the course for the next few months, it's currently being piloted at 4 universities, one of which being Boston University. The others are the University of Ohio, Drexel University, and UC Davis. And just to briefly go over some of the concepts that it covers. So we wanted the course to be interdisciplinary, given that the issue of forced displacement does cover many different disciplines, and we want students to be able to communicate across disciplines and realize that approaching issues only through data science or STEM was always going to be limiting. So they cover data representation, analysis, and visualization, and we want to equip students with an understanding of the limitations of relying solely on data, to be able to critically examine the data that you're using, so understanding, for example, who's left out of that data, what are the implications of certain narratives about refugees and migrants, and how is that informed by this data. We also wanted to introduce design frameworks and emphasized on the importance of human-centered design in these contexts, help them grapple with ethical dilemmas and the complexities of engaging with issues related to forced displacement, explorations of who benefits from this research, is it really benefiting the community, and then also the importance of protecting the privacy and security of these communities, especially in contexts where, for example, refugees might be fleeing from oppressive governments and are especially sensitive to their data being protected. So that's just a brief overview, and looking forward to the discussion. Thank you.
Hi, everyone. My name is Daphne Joseph. I believe titles are temporary, but purpose is permanent. And so my title right now is I'm a research fellow currently at McKinsey & Company, but my purpose, I believe that I've been just here on this earth to serve underserved populations, specifically immigrant populations, and to just address their needs. And so I do that through philanthropy and economic development. And I just kind of want to share a little bit of my background as to how I got to this point. I believe that when I walk into a room, I don't just bring myself, I bring all of the people who did not have the luxury of being able to come here, who don't have the just education background or even certain systemic barriers that kind of prohibit them from being able to access spaces like these where we can think about solutions towards humanitarian issues. And so I want to talk about my parents who are Haitian immigrants who came here to the US in the 90s, and they inspire a lot of the work that I do for immigrants in the US right now. In 2010, there was an earthquake in Haiti, and the entire world saw this and I believe just felt the empathy and compassion and donated billions of dollars to Haiti. And it was so aspirational. They wanted to be able to just create housing and infrastructure in Haiti, except there was not many houses were built. Till this day, no one really knows what exactly happened to the funding. And Haiti continues to struggle because there's just not much that can be done from an international standpoint without an understanding of what is exactly going on. There's a long history of corruption, violence in Haiti. And so we reach this kind of point where we're wondering just what can be done, whether it's philanthropically, whether it's economically, whether it's just through humanitarian issues. And so that inspired my work leading up to Spelman College. When I was at Spelman College, I learned that Haiti was the Haitian Revolution was the first revolution specifically targeting human rights. Because they were in the Caribbean, there were so many different types of people, Black, brown, biracial people. And so they had no choice but to advocate for all humans' freedoms. And so it became the first revolution targeting human rights. And so that inspired my passion of being able to advocate for human rights at Columbia University. There, I was able to study policies that impacted immigrants in the US. And I probed the question, what is the difference between an asylum seeker, a refugee, and someone who is here just, for lack of a better word, illegally? And so the US, we have policies that specifically address each population differently. And for some reason, Haitian migrants who were fleeing corruption and a lot of violence, they were given temporary protection status as a solution to their issues. And so that was just one of the things that I was examining. And then I came, prior to joining McKinsey, I spent a week in Mexico on a mission trip with my dad, who's a pastor. And we came there to just kind of understand the needs of the people and what was going on in Mexico. We found that there were huge Caribbean populations escaping a lot of violence there. They were experiencing extreme poverty. And after a week of interviewing hundreds of people who were just desperate for safety, I left with really bad sickness because I accidentally drank the water there. But I also left with the burning question of, if I had $1 million, how would I use that to be able to impact these types of communities? Just like tactically, what would I do? Would I address shelter? Would I address their medical needs first? Would I address just food? What would I do to be able to impact them? And so that led me to McKinsey, where I've been studying philanthropy and philanthropic data, economic development data, to be able to probe that question over and over again. There at McKinsey, I've been able to support philanthropic organizations and to help them. There was one client, which we're pretty private about the clients that we work for, but there was one client that I supported who they made it a mission to, they were a billionaire and they wanted to die with like a negative bank account because they wanted to spend all of their money on philanthropic and humanitarian issues. And so when you have large sums of money, what do you do to create the best impact? And so I believe it's so important to have the data, but it's also important to have make sure that the data is accurate in terms of representing both qualitative and quantitative data. So yes, the data says being able to support through workforce development initiatives might create the longest impact, but what are the citizens, what are the residents, or what are the people saying? When you interview them, what are they expressing their needs to be? And so I find it so important to not just look at the numbers, but also to complement them with surveys, research, interviews, expert interviews, and to just provide a holistic picture of the needs of people so that you can create the best impact. And so I'm excited to provide that mixed method, qualitative and quantitative side to this discussion. And yeah, thank you so much for listening.
Okay, great, thank you. So I guess I'll just pick up on that, and it's a theme that all three of you brought up, is really kind of centering discussion in communities and gathering information before designing any projects or programs or even starting the data analytics. So I wanted to kind of get more detail from each of you, how you think about centering and user design, avoiding kind of just a technocratic, we know what's best because of the data. I think this is an issue that data science as a whole is starting to grapple with in the last few years, that data can't solve everything. So curious how you keep that at the forefront, that the user is the center and that data is meant to serve the user if it's appropriate, and kind of challenges that you see to that in your day-to-day work.
This has been handed to me. How do we keep on doing it? How we keep on doing user-centric design or orienting around user-centric design? Stubbornness. No, because I think this is one of the things that I very briefly mentioned is that I work within academia. Funding really likes shiny things. Harvard really likes 1 billion papers. So the user-centric design process does not produce as many shiny objects or as many papers. It is a longer, more intensive project, right? But at the end of the day, I didn't come here to become a professor at Harvard, right? I came here it's kind of talking about purpose, right? It's not about label, it's about purpose. I came here to do things that impact the populations that I hope to serve. And I also have to recognize that I'm not the expert on their lived reality, right? And building out conceptual models based upon my assumptions, based upon my experiences, they're just going to be wrong. Thoughts?
Yeah, the point about the university's kind of incentivizing work that doesn't really center communities as much, that's something I've seen as well. And in the workshop we had, actually, a lot of professors complain that when they try to do this work of, they're all based in engineering, so when they try to do this work of engaging communities and more interdisciplinary work, they're told that your work isn't rigorous enough, it's not going to fulfill these engineering requirements, and so there's definitely less of an incentive to do those things. But in terms of our work with UNICEF, just going into it, there was like a lot of skepticism about us as computer scientists, data scientists coming in. I think they had the impression that a lot of people in our position will come in and think that we can replace their years of on-the-ground experience, like the nuance that that brings, which was never the intention. Of course, we wanted to complement their understandings and center that. So I think something that helped a lot was just making sure that they were involved in the process of developing the model, even if we couldn't maybe break down every detail that went into it, just telling them these are our assumptions, so they make sense to you, and they could like pick things apart that didn't make sense, instead of just like developing a model on our own and coming to them and saying, here are the results that you should make decisions by yourself, and they don't really know what went into that.
Yeah. Just during my research or just my time at McKinsey, we use a lot of data. I do a lot of work with like state and local governments in the U.S. And we provide like a landscape of just what the economy of maybe certain states are or certain cities. And the privilege that we have is that the U.S. has probably some of the most robust set of data in terms of infrastructure in the world. I mean, it's in probably the top. I don't want to say the number one, but you get the idea. And so we're able to address issues like poverty and understanding why a certain state is experiencing extreme poverty and provide solutions based off of the existing data that we have. Other countries, they may not have a lot of the infrastructure that's needed to be able to just acquire that data. And so first, the barrier is that there's a limitation in terms of like what data exists, especially in countries that are constantly experiencing humanitarian crises. The second thing is that when someone is like in the middle of crisis, the last thing that they want to do is take a survey and let you know how you're how they're experiencing just the crisis. And so I think that's just something that's an ongoing question of like, well, how do we collect relevant and important data that will be able to provide change and create long-term impact? And so maybe that's collaborating with the organizations, the humanitarian organizations, and following up with people or training people to be able to collect that data real time and maybe making that process a little bit more efficient. And yeah, just considering the needs of the people who you are affecting. A lot of times they need their primary needs met. They're not trying to just fill out a survey to share like how they've been experiencing the services that maybe humanitarian organizations are providing. And so maybe it looks like addressing their immediate needs first, and then kind of thinking of long-term solutions and requesting data at that point.
Yeah, thank you. I think that ties in with another kind of question that is always hanging over my head when I think about using data and for working in conflict zones or just working in the humanitarian space in conflict zones in general, which is kind of the additional ethical considerations that are required. So again, when working with data, I think this is something that the data science industry as a whole is grappling with. Data makes everything bigger, provides a lot more granular information on individuals, but especially in contexts where there is already violence and danger. As you said, just collecting data may put people more at risk. Having data exist on certain individuals may put them more at risk. So how do you and your teams think about centering ethics when to even approach starting interventions or projects, kind of where you draw the lines there and how you kind of ensure that the communities you're trying to serve are not harmed by your efforts?
I'm not going to speak first.
I'll go first. So the question is just on like maintaining ethical concerns. Something that I observed when I was in Mexico, speaking to the very vulnerable populations, was that first off, they were displaced, and so that left them very vulnerable to not just like the immediate needs being threatened, but also like on their route to safety, they would be vulnerable to like human trafficking and things like that. And I think about if we do have more data about their locations and where they're seeking help, it makes them a little bit more vulnerable if the data is placed in the wrong hands. And so I believe conflict or just crises, they present opportunities for opportunists to kind of take advantage of these very vulnerable populations. And so when we're dealing with data, I think it's very important to think about regulation and privacy, because the populations that we'll be working with or we're working with, they're vulnerable, and already their lives are at risk from the crises that are happening. And so it's really important to also advocate for the privacy of that data and making sure that the data is secured and in the right hands, and that it's not easily sold to whoever has the highest bid. So that's my thoughts in terms of ethical concerns.
So unfortunately, the woman who can't be here because she's COVID-ridden is an expert in this, and she's extraordinary and thoughtful. But one of the things that we've talked about many, many times is we need to create ethical frameworks. Whose ethical frameworks? Who's defining those ethics? What goes into those ethics? Who has the right to define those ethics within this kind of data space? Right now, there's not a standardization. There are many different ethical frameworks for data in crises. There's the HOT OSM framework. There's the Signal Code, which I may or may not have been part of. But it takes into account multiple different components of what do we think about, like the ethics of data science in conflict communities, right? So we think about consent. What does consent mean when we're using drone imagery, when we're using VHR, when we're using cell phone data? What does consent look like in that context? What does consent look like when we're offering services for data? It sounds a little bit like exploitation, right? So consent is a question. Utilization is a question. How do we avoid exploitation of these communities? How do we make sure that we just don't go and do research after research after research and not actually end up providing care? Whose data is it? Shouldn't be my data, right? It's that community's data. How do we navigate data use agreements? How do we make sure that privacy is maintained? How do we make sure that people aren't increasingly targeted? So not only looking at PII, personally identifiable information, but DII, demographically identifiable information that can be utilized in order to target certain vulnerable communities, populations in conflict zones. It's an overwhelmingly difficult question. I think that continuing to evolve this narrative and look at the different types of ethical frameworks that exist out there, it's kind of starting to bring us to some version of consensus. But one of the things that we always do is we red team every project we do, right? We say, okay, so if this data gets out into the universe, what can happen? If I assume malintent of someone who has my data, who dies, right? Because if I bring in someone and they say, like, here, take this data, do the worst you could possibly do with it, then we start to see what could happen.
Do you have anything to add?
I think they covered everything, but I definitely agree with the need for frameworks. And one pretty well-known example, there was a refugee camp in, I believe it was Jordan, where they introduced biometric iris scanners. And so they said these would replace your ID cards where you get your food rations. Instead of using those cards, we'll scan your eye, identify you, it'll be more efficient. And so people were very skeptical about this. They didn't know what would be done with that information. A lot of them said afterwards when they were interviewed, they didn't know why it was being collected. They didn't know they could opt out of it. And like Erica mentioned, like the power dynamics of like, you have to do this in order to receive food makes it like, you can't really say no. So yeah, I definitely agree. It's like, I think a lot of it has just been very, like we react after there's been a huge disaster instead of being proactive and establishing frameworks to avoid that.
Okay, thank you. And I guess so we're getting close to the end, so I'll maybe ask one more brief question of all of you and then open it up to the audience for any questions you have for the panelists. So I'm curious maybe on more positive what data can do note. in the next 5 or 10 years, looking ahead based on what you've seen being done in this kind of conflict for humanitarian working conflict space with data or mixed methods, what do you see as kind of the most promising approach or method or tool that you think will potentially have the impact? You're sorry. Okay. Or what, as an alternate question, what are some, like, is the project that you've worked on that you felt has had the biggest impact so far, or that you're kind of most proud of?
Okay, I can talk a little bit about. So I worked on this project with this global foundation, and it was just a proposal to kind of observe how we can just be able to look at various African countries and be able to provide or increase their education outcomes. And it's such a huge, just aspirational goal of being able to externally impact such a really rich nation, or not nation, I don't know, continent, Africa. And so we had to kind of, our methodology was just kind of looking at what exactly was happening in Africa right now in different countries. So who were the stakeholders, the existing stakeholders, different NGOs, different organizations? Are there any public or private partnerships existing? And what's just the overall landscape of those countries in terms of economic data? And then it was just, we had to determine what was positive impact. Was that increasing the number of students enrolled in specific schools? Was that increasing retention or the completions? Like, so many different metrics to be able to determine what was a successful outcome. And so to me, I think it goes back to that overall question of my question of, if I had $1 million, how would I be able to create the best impact? And it was just an opportunity for me to attack that question and really probe it from different perspectives, while also being able to positively impact a community of people who we know education is like a superpower. And so being able to do that was really amazing for me.
Thank you all for your attendance, and thank you for your participation in this discussion.